Hello, everyone, and welcome. We're just delighted that you've tuned in for Hawthorn University's All About Alumni series. I'm Paula Bartholomew, and today I have the pleasure of interviewing our graduate, Carolyn Dolan, and you'll have the opportunity to ask her questions directly, too, and I hope you do. Hello, Carolyn.
Well, hello. Thank you for having me. Can you hear me?
Yeah, I hear you great. I hear you great, and I'm really excited to be here together.
Yeah, me too.
Sure. And it's a pleasure to be able to introduce you and your presentation, SOARing Recovery, Driving Change and How We Heal in Allopathic Medicine. So today, Carolyn shares her experience as a new graduate from Hawthorn, getting started in her career as a healing specialist physical therapy consultant using nutrition, lifestyle, and supplementation to reduce pain and promote healing from orthopedic injury surgery naturally while decreasing the need for opiates. She's focusing on complementing traditional care both for the outpatient and in-hospital patients. Carolyn completed her Master of Science in Holistic Nutrition in June 2017, graduating Summa Cum Laude, and came to our industry through her own healing journey and her desire to improve the healing of her patients in her physical therapy practice. Her mission is it's twofold: to serve as a resource for healthcare providers that seek to offer an alternative to their patients to reduce the need for addictive pain medications, and to provide a comprehensive and practical healing plan for the patients recovering from painful conditions, injuries, or surgeries seeking to avoid the pharmaceutical pain medication route. So that's big work that you're doing, Carolyn.
Yeah, it's big work. Okay.
There you go. All right, good. So let's get started. We'll have you get started and tell us a little bit about your background and how you ended up in holistic nutrition.
Okay. So I am a traditionally trained physical therapist. I have many years of experience with physical therapy and specifically in the outpatient orthopedic world. But I'm also the mother of 3 growing children. And about 5 years ago, I went through my own personal health journey, where as a mother, I was getting frustrated with my chronic sinus problems, fatigue, and even some postpartum depression issues. And I started specifically with exercise, actually, and then I ended up falling into the Paleo Solution book by Rob Wolf, and prompted actually by some professional colleagues of mine that I worked with. And so as I went down this road of the world of paleo and eating really just whole nutrient dense foods, I started noticing my personal improvements in my health and well-being, but I also started to notice that of my husband and my children. And as we continued down that path, my husband, who is a orthopedic surgeon, he was getting comments from fellow physicians in the OR, in the office, that he was going to die of a heart attack if he ate a steak. And so I remember thinking about that, going, well, that just doesn't make sense. But I'm going to research this because I obviously wouldn't want to put my children at risk. And I wouldn't want to put my husband at risk of some sort of ill effects, even though we were having what we thought were very positive responses to eating real food. And although we started out paleo, what it really ended up is we eat paleo inspired in the sense that we eat nutrient dense whole foods over processed foods is really where our focus is. And so as I started doing all this research, I was just astounded by all my PubMed literature reviews and looking at the science, that I was really shocked at how this was a huge component of all of my allopathic physical therapy training and my husband's training that we had completely missed as far as recovering from painful conditions. And so I actually had written a book, of which got published midway through my master's in holistic nutrition while I was studying at Hawthorn, as a means to offer something simple enough that my patients and clients could understand and that they could apply to their lives. But then I kept going. I knew that as I was continuing to grow professionally within the world of physical therapy, that I needed to have an additional training of really how to incorporate this holistic nutritional lifestyle and learn more about how to fine tune it more in a personalized recommendation format. And so that's where I ended up here at Hawthorn, actually. Again, I mentioned a couple of my colleagues in my office that I was working at the time had gone this paleo route and whole foods route and had mentioned Hawthorn University, and I looked at a bunch of different programs, and I really wanted a solid, useful foundation that wasn't based on the food pyramid. I didn't want to go back to become a registered dietitian, because I really wanted to get a good foundation, a practical foundation of things that actually were based in the science of what I was finding along the way, but also allowed me to continue to raise my children. And so that's how I ended up at Hawthorn. And so this provided me that reputable education and a strong foundation so that as I continue forward professionally within the allopathic world, I have a really strong foundation to stand that supports me, and I can defend what my recommendations are. So that's my story, and I don't think it's too unusual. A lot of people end up here at Hawthorn having their own personal health struggles.
Sure. But few are also trying to reach out into the allopathic medical community that you're steeped in as well to bridge that world. So it's really a beautiful transition that you're making. And so let's continue on and talk about how you've progressed professionally and if Hawthorn has helped you in some way with that too.
So Hawthorn has really helped me over the couple of years working on my master's degree, and this current program I am really focusing on within the allopathic community is essentially my thesis coming to life. Again, I mentioned earlier my husband's an orthopedic surgeon, and I am a physical therapist, and I focus on that orthopedic population. And so part of my research into my thesis was really trying to come up with a program that could really be implemented within that patient population. I clearly had the idea in mind that not only could I use it for my clinical practice, but I was focusing in on where it could most be beneficial and used for even the physicians or surgeons treating some of these conditions. And so I worked on this 5-step program. And this is what I've worked with. The person who helps me with my website really helped me kind of design the color scheme and stuff. But I use this image because it's the 5-step program of eat well, move well, sleep well, connect well, and supplement well, of which I use the analogy of baseball for folks. Because as we know, as holistic health providers, it's hard to get everyone to do everything they need to do. But as far as improving healing and reducing pain within this allopathic framework, if we can get somebody to do any one of these things, if all they do of the whole program was to change how they ate a couple meals a day, we could have a pretty dramatic impact on their healing. And so as far as baseball goes, you do any one of them, it's a base hit. You do 2 of them, it's a double. You do 3 of them, it's a triple. 4 of them, it's a home run. You get all 5 going, and it's a grand slam. But the point is, each positive move is progress to helping that healing process. As far as my degree in Hawthorn, continued to strengthen my ability to not only develop this program, but continue to write and blog and share and be able to speak the language of the allopathic community even a little bit better, as far as the science that supports it. I have been continuing to implement this particular program in my business to offer, and we mentioned about my goals. I not only wanted to be able to offer this to my personal clients for my business, but I also wanted to be able to work on offering something that other allopathic health providers had a resource to use when they had a patient or a patient come in that really was interested in, not taking the opioid pain medicines, or they really wanted to be an active participant in their healing process. because I think that is largely missing in our allopathic framework right now. Because I figured if I needed something, like if I needed to have an orthopedic surgery, I wanted to have something offered to me that was outside of what is in the traditional path. I have now presented this thesis project. Paul and I were just talking about how I had connected with a chiropractor in town. I've spoken to other physical therapy colleagues as well. And I have even reached out to some colleagues within the medical community, an anesthesiologist, to kind of confirm that he would support this process and this program in his surgical patients. And I spoke to some physician assistants that are in training, some RNs. I recently spoke with a pharmacist about it. Just trying to get the word out. And the pharmacist actually works for Medicaid, the state healthcare, and we were trying to brainstorm ways to try to implement some of this within that patient population. So I've actually, within the allopathic community, my connections that I have, at least verbally, I have some really positive feedback, that they are also seeking to be able to offer something to their patients that's evidence-based, it's based in science. This isn't, although the holistic community and this alternative community, this fits very well. I think we're at a state, and the more I continued on my degree within Hawthorn, I realized how much, this really isn't alternative in my opinion anymore. This
Right.
is based in science, and this needs to be offered within even for the scientific community and the allopathic community. And they just haven't had it. They didn't get educated in it, but they know that we have these problems. Like, people are getting infections, they're not healing very well, and they end up in chronic pain states or addicted to pain medicine. So they absolutely know that it's a problem, but they haven't had anything else to be able to offer. Let's see. So, really, this Hawthorn really prepared me well with this thesis project to really then implement it into a business strategy. And like I mentioned before, it really gave me that strong foundation of knowledge and physiology and the scientific literature. So when I do present these to people who have the allopathic background, that they actually aren't looking at me like it doesn't make any sense. They're like, oh, I see, I get it. Oh, this makes sense. Oh, I want to be able to offer this to my patients. So, and I've had some really positive feedback. I've implemented it with a handful of patients to this point who are having pretty dramatic improvements. So, like an recent ACL, I believe he was 35-year-old male. And I think he was a psychologist, and he implemented this program with the supplements, and specifically he focused in on some of his eating strategies. He was working with physical therapy, allopathic care for his movement, and he didn't do so much of my sleep and the connection, but he, within his first week of post-op time with his ACL repair, he consumed, this is his report, he consumed 1 opioid and 1 nonsteroidal anti-inflammatory to sleep within that first week, and he has since not consumed any other than the supplements that were provided and his eating strategy changes, and he feels dramatically better compared to his past knee surgery that he had to have about a year ago, as far as his pain and his mood. So I wouldn't have come to even this program if I hadn't been thinking about my thesis project, right? So it really helped be a springboard professionally to really get focused in on a specific patient population.
No, I think it's brilliant, what you've done. And, this is all framed in very much the holistic context, but you don't have to say, I have a holistic approach to this when you're speaking to the allopathic model. You say, these are the 5 components of my program. And I think this is a good idea, a good time to just, if you can just expand a little bit about what you're recommending in each of these 5 steps? I think that might be really frame everything that you're doing here.
So I really used the framework as I was looking for a solution to a complicated patient scenario. I have, over my years of experience, come across chronic regional pain syndrome. I don't know if the audience is all that familiar with it, but it's a really devastating chronic pain state that requires dramatic changes in lifestyle, and people lose a lot of function, end up with severe mental health issues, and chronic use of pain medicines, of which then they still end up in pain and a decreased functional state. And so I was looking at ways, what's the cause and the treatment for this current disease, so that we can use that model as the canary in the coal mine. What are we missing for the recovery for more people that results in this type of condition? And so that's where the 5 components, I really focused in on actually the leaky gut problem and intestinal permeability, and how that gut-brain connection sets you up for not only an aberrant inflammation, but sets your brain up into a heightened pain state, and that you decrease your ability to absorb nutrients, so you're not optimizing your healing. So of that, each step was kind of chosen, and I researched, where the data was, eating whole nutrient dense foods, which in a musculoskeletal problem also includes incorporating animal protein that is naturally gluten-free, of which is, again, I'm coming back from this leaky gut problem. And then I talk about movement, and for me, this movement piece is not meant to replace any traditional occupational physical therapy or movement specific therapy or even chiropractic work, as much as it's to support that and try to get people to move outside in the sun when they can and safely, because vitamin D is such a critical vitamin for musculoskeletal healing, as well as promoting sleep. And so then the next component is sleep well, where sleep is such a hard thing for people who have pain.
Yes.
But that we can promote it to the best that we can while we're going through those healing stages, by darkening our room, cooling off our bedroom, and that actually getting the sunshine and eating better can also trickle down to improve sleep. And then my Connect Well portion is more about that brain, your brain on pain, right? The brain component, where we talk about stress optimization, some tools that are used often, particularly for CRPS, like motor imagery, that I bring it in here as a means of preventative, so if you had one particular CRPS patient was a avid runner. She was a young gal, she was a mother, and she ended up having to have hip surgery, and suddenly she couldn't run anymore, right? And so she was laid up for over a year, whereas her stress management system often was this exercise, which she couldn't do, but she could have helped kind of keep her brain calm by doing some of the motor imagery without the actual movement. And things like deep breathing, diaphragmatic breathing. I've had a handful of patients say that that's been an incredibly useful tool for breakthrough pain, especially at night. And then, of course, the supplements are professional grade, high quality, and that they are specifically chosen for a specific dosing based on the research to promote a reduced pain, promote gut healing, and optimize soft tissue healing. So that's what my whole program is. And like I said, what I find most people are driven towards actually is the nutritional component and recommendations and the use of the supplements. Along with that, trying to bring in some of the psychology. I've included in my program a insulated water bottle. And I think it's a stainless steel water bottle, because my idea is that if I can get someone to eat a whole foods breakfast, they're drinking out of their thermos, their broth or water, and they're taking their supplements, that the time of day I'm starting to trigger some behavior changes is what I'm going there. But that's my program. And so far, so good.
All right. No, I really like it also that you've done a very specific and very sellable supplement pack of specific nutrients that are very targeted to healing overall. So it's
And
very
it's fascinating because it's nothing, I mean, that our community would think is unique. I mean, it's vitamin C. I mean, it's vitamin C, it's turmeric, it's fish oil, it's vitamin D3. I mean, and probiotics and enzymes. I mean, these are, but there is data that supports it in this orthopedic population. So
absolutely
it's been great.
right. No, I'm thrilled here. And look at this, what you have up on your, we're moving on to your website now. Just beautiful. So let's talk about your website and what your next steps are after developing your program.
So as far as I've got all these great ideas from, you know, my degree, my education at Hawthorn. And then it was about really trying, I'd had a website before that people were kind of confused about what it was that they were supposed to do with the information or what their action was. And so one of the best pieces of advice I have for new grads getting started is that when you need to make your website simply your business card, you want it to have enough information to explain what it is that you're going to do, but you really need to make sure that that business card has a call to action, that it's very clear when you're referring someone to your website. And I needed it to be very clear because I had patients I would refer to the website, or I'd have other clinicians referring patients there, that I wanted the patient to go there, be like, oh, that's what they told me it would be. That makes sense. Now this is how I get going. So making it very clear that I need to, what the patient's action is going to be when they look at your website. And that this required some help with, you know, the color schemes of a professional website designer. And, you know, you can do these things on your own. And I had dabbled in that the first couple of years I was out on my own business strategy, to my own business. But having a professional help you with this step may be one of those things that's well worth your financial investment, because this is going to be what the professionals see, your clients see, and you need it to work seamlessly in many ways. And so make your website like your business card so it's very clear what you're trying to sell, and then make it very clear how to make the action step. And so I've got a button that says, are you ready to soar into healing? Of which because of the supplements and because of the program, I have some screening questions for clients to fill out prior to scheduling and paying for my services. Now, I personally found in my past that I would spend a lot of time doing these marketing phone calls and trying to get through some of this information. And I really wanted to work on capturing it so that when I get that consultation on the phone, that we're working on their program. Rather than fishing through, you know, are you 18 years or older, because this isn't designed for the pediatric population. So yeah, so that has been a very critical, important step for me as a business owner.
I like it also because once you've started working with people, you've got the action steps right there too. And people need things in writing, particularly those of us that are dealing with health conditions, that are in pain. Being able to, you know, there's cognitive dysfunction that comes in here with pain, you know.
Yeah. Yes.
It's just, we can get easily overwhelmed. So having things that you can go back and say, these are the steps that I need to take and follow through is a beautiful thing.
And I will take a back step really quick, is that my program, you know, I talked about the 5 steps and I include the water bottle. My program also includes the supplement pack. It's a 30 or 60-day supply along with the separate probiotics, but it includes another booklet where I go through each step, and it has information on the foods that are, you know, a shopping list, a meal planning guide, and a few recipes. So each one of the steps, like you mentioned, because people will come to you in pain and they hear what you're saying, but it doesn't necessarily sink all the way in.
Yes.
But I give them not only what's on the website, but just a little booklet that comes along with the program so they can refer back to it.
Fantastic. All right. Well, you just put up one of my favorite John Lennon quotes, and I'm curious about it because we've talked about your program and a place for your clients to go. And so why are you bringing this quote in now? And what does it have to do with running your business?
Well, it's been pretty fascinating. So I felt like as I started with my thesis project that I had really narrowed in. Everything seemed so clear. It made so much sense. And that I didn't, I thought it was going to just be this smooth transition. But again, I'm trying to get my foot in the door of making some of these changes within the allopathic community. And so this is one of my favorite quotes as well, right? And actually was used often by my meditation teacher, that there are no problems, only solutions. And I would run into barriers, right? And it would stun me. Like, I don't understand.
There's not supposed to be any.
This doesn't make sense. But that if I focus too much on that barrier or the problem, I'd lose the opportunity to find another solution.
Yes.
And so I thought this was just a really important point, particularly for the new graduate starting their own business, that you might run into problems, and it's okay. And you should actually, I think it was, my expectation was that there wasn't going to be a problem, and that was the problem, right? But that you might run into these barriers, but there's always going to be a way to learn something from it or find a different solution. And it was really, for me, with some of my patient responses to the program, and when I go back and I look at the science of my program, I just go, this is such a good solution. I just need to figure out how to kind of move around this allopathic healthcare, because I think I know there's a place for it. Basically, I said, I feel so strongly and confident in this program that there is a place for it somewhere. Just need to work on finding it. And so I mentioned earlier, I'll share a little story, because when I was working on my thesis, I was really focusing in on that orthopedic community, because my physical therapy background, my husband's business as an orthopedic surgeon, and so I really was focusing in on that, and I thought this would be great to have within an orthopedic surgery group. And so that was exactly where I was headed. And I brought my program, with my beautiful images and my thesis, and I walked into the office manager's office and I did my little mini presentation, and she said something to me like, "You can change the world with this." And I said, "Well, maybe, but what I really want to do is help my healthcare community that I live in. Like, let me just start here." And she presented it to the board, of which the president of the orthopedic surgery group, of which my husband is a part of, didn't even look at it, and couldn't, and I'm not sure I totally understand why, but he wouldn't even look at the proposal. And he decided we needed to have a nepotism policy in place for their group, meaning that no family members could work within the group. And I was really stunned. Like, I was like, this isn't what I expected to happen. I thought I needed to defend why turmeric was a good supplement to use. Like, I was collecting all my research articles, so I had them on hand if somebody questioned me about the science behind it. I said, this wasn't what I thought. And this is where this quote really came in for me, because initially I was stunned and I was like, well, this is not the problem I expected. But then shortly, within a couple of weeks after that, I got connected with the COO of a local hospital system. And I presented the same package deal that I did to that office manager. And she was like, yes, I want this in my hospital. Can you present this to the other managers and some other folks to see if we can start to do this? And so there was that problem, opened up a different solution. It wasn't what I thought I was headed into, nor what I thought I designed it. I had designed it specifically for this orthopedic surgery group in mind, but that another door opened. There was another solution that I hadn't thought of, right? So
Exactly. And it's an interesting door that closed, because I don't, obviously it wasn't anything about your program specifically, because it was never looked at. It was the concept of it. And it wasn't nepotism either. I don't think so. I think that was the excuse to just reject something that's out of the norm.
Yes.
Personally,
I can't judge exactly what the impetus was. I know my husband and I were both very disappointed. However, it's a group, so it was a group decision. But
sure.
And I suppose it did open to my eyes. That was the type of barriers I thought that someone was going to turn it down because it was different within the community. So, but another door opened. There was a different solution.
All right.
So.
And another slide. This is an interesting slide. Let's get into this a little bit.
And so with that experience, actually kind of brings me into another important part about being a solo practice owner. As you graduate and you're starting your own private practice on your own, it's very individual, right? You're really focused on doing work on your own. And that experience that I had with the orthopedic surgery group really opened my eyes to how much I really needed a tribe of people. And this particular slide is an image between how the Western versus Eastern lifestyles deal with, independent versus dependent. And I was finding myself, as I was getting so motivated on my, singular program, that I was falling way in, almost too far into this independent strategy, that I forgot to really be reliant and dependent on the tribe of people I had connections to that supported what I do, but also had similar ideas. And so I bring this up because I think it's important to continue to stay connected to fellow graduates within Hawthorn or other holistic health type communities. But for me, it was also, you and I were talking earlier about physical therapy being a pretty open-minded professional group of people who were very interested in other ways to improve healing and reduce pain. And so I had to start to reach out to my fellow colleagues that I had, years ago, that I had worked with when I was working at the hospital. And so I had to reconnect, and I had to reach out to my tribe, and, they helped me say, don't panic, you're doing good. This is, another door is opening. It's going to be okay. And that they can also help problem solve when things come up and support you. So this was really just another, this image just spoke to me as far as representing the importance of, we are independent business owners, but you need to make sure you continue to stay connected to folks that help lift you up and are doing similar things, even if it's remotely through Facebook groups or going to conferences and things like that. So finding those people, reaching out to those colleagues near and far, and other professionals that can support you through your growing and your business strategy.
Yeah, I agree. It's so important. And I think that Hawthorn is fairly supportive in this endeavor, in this concept of tribe also. Is that your experience?
And this is a great example of it, not only having these alumni webinars and the continuing education opportunities that you continue to offer remotely, but one of the people that I actually reached out to was a fellow grad who happens to live locally, and that's Dr. Tara Finley, who's a naturopath here in town. And so I actually reached out to her to discuss some things and even talk about how my program might help her practice. And so, yes, Hawthorn really offers a lot to continue to have that tribe surround you and support you and help you through some of those challenging times, but also help you continue to grow as a practitioner. And so Hawthorn has been really wonderful to help me grow my tribe and remind me that my tribe is there. So.
Yes, you're not alone, Carolyn.
No, and that's been, and you get lost in that though. You sometimes forget, and but Hawthorn, Hawthorn has been a great resource for continuing to grow my tribe and a resource for me.
Well, it sounds like you have really a solid foundation of knowledge and support, broad support from Hawthorn and within your community and your tribe, and I'm thrilled for that. And you've had some really good tips and suggestions for our new graduates and business owners that you've learned along the way. But let's go into some of the more tips specifically. You're getting into some human psychology here, and I think that this is going to be even more revealing when you discuss this slide.
Yeah. I remember a physical therapy friend of mine, as I initially started my coaching practice, just when I was doing the health coaching, she said, it's all about psychology, Carolyn. She kept telling me it was all about the psychology of things. And I thought, why can't it just be about the information? And so, you get a glimpse of it within the education at Hawthorn, which is a great introduction to, I forget what the name of the course was, but it was a great introduction to starting down that path of psychology and trying to stimulate habit changes for your clients. And I used it and I referred to it, and then I happened across Gretchen Rubin's 4 tendencies. And I love things that are clear and simple, and that's how I try to make my program clear and simple. And this is not all encompassing. This isn't the only thing that you can use from a psychology perspective. But I started to use Gretchen Rubin's model of, she talks about 4 tendencies, personality tendencies, and she researched them based on how an individual is going to respond to an expectation, both an inner expectation or an outer expectation. So an inner expectation would be something like that you would decide to set a goal for yourself or a change you want to make. And an outer expectation would be something like how you respond to a work deadline, right? So whether or not you readily meet those expectations. And using that model, when I explored it, it really helped me understand myself better. But it also helped me understand both my successes and failures for my patients and clients. Because I would have patients that while we were working together really would do amazingly well. And then I'd run into them a year from then and they'd fallen off the wagon, so to speak. And so she talks about, and the 4 tendencies she comes up with is an upholder, which is somebody who meets an outer expectation readily and meets an inner expectation readily. Meaning they don't need much pomp and circumstance to change something. So they're going to be the ones who, you say, eating fruits and vegetables is really important for health and wellness. And they're going to be like, oh, okay, I'll do that. And they do it. And they've now internalized it. No, you don't have to hold their hand. You don't have to explain it much of anything because they've decided they want to do it. It makes sense. They're going to do it. Now there's an obliger tendency where they're going to readily meet outer expectations and they're going to resist their own inner expectations. So these are the people who say yes all the time and they're going to tell you that they're going to do what you've asked them to do, but they really need an external accountability structure. They have a really hard time setting a personal goal and maintaining that personal goal. They tend to let themselves down. So the obliger tendency is somebody who needs, an accountability group, or, many people who do, I'm in a P90X groups and think, that home fitness thing, where everyone's keeping each other accountable, even if it's remotely. That tends to be a pretty good fit for some of the obliger tendencies. Mm-hmm. You have a questioner. They resist the outer expectation, but they'll meet their inner expectations. And they will resist an outer expectation until it makes sense to them. Mm-hmm. So they're the people that are going to question you up and down about the scientific literature or the research or why this or why that. And they almost sometimes get paralyzed by their need for information that they then can't make a decision. But those are a lot of my most challenging clients are the ones that continue to ask why. Like they're not going to make the change until they decide it makes enough sense to them. And so you have to kind of arm yourself with your battery of data, so to speak, and you just keep throwing it at them until they finally say, oh, this makes sense. Okay, now I'm gonna internalize this and I'll make this change. And then you have a rebel tendency where they tend to resist outer expectations and they resist inner expectations, and they really need to feel like they are in control. So you can't tell them what to do, right? Because they're going to resist that. It's not that you can't work with them, but they need to have choices and options and feel like somehow, even if it's just a perceived control, that somehow they have that control. And so when I explored this little questionnaire, and she has a free, and this is the other thing that's really great, she has a free questionnaire online on her website where I now incorporate this with my clients, so that if I know I'm going to be working with an obliger tendency, that I know if I'm going to help keep them not only successful while they're working with me, that when we're done, we need to make sure that they've set themselves up with some sort of external accountability structure, be it, you know, a friend of theirs where they're going to meet. I'm sort of making this up. Often I have this for people with their fitness strategies or partner support for nutrition changes, that I work with them to negotiate with their partner or somebody or a parent or something that will keep them working on eating their real foods even once we're done. So it's been a useful strategy, and we get a really great introduction of this psychology piece with our education in Hawthorn. But if there's any one thing that you need to continue to be exploring and learning about, I would say it's just understanding. The more you can understand human psychology, the more successful you will be helping your patients both immediately and in the long term. Mm-hmm. But that it also helps you understand yourself, which also kind of leads me to my next thing here, but about understanding your own personality so you can design your business to fit who you are too. So that leads me to my second.
No, good. I love these tips. So let's explore this one a little bit more, because I agree with you that understanding psychology will really help you in your practice and help you grow your business. But it has to fit in a way that supports who you are and how you are working with your clients, and to develop the success around that. So let's talk about this and see how it's affected your business growth.
So as far as for me, it's been, you know, that questionnaire really was one of those opening experiences for me to understand a little bit more about myself, mm-hmm. so that I could understand the things that I was good at doing, the things that I was driven to do, and the things that I maybe wasn't as passionate about doing. So for me personally, I have always struggled with money collections. You know, I love working with patients and clients directly, but the actual act of like collecting the money somehow always got me in a frozen place. And I've always wondered about why that is. And I've never had to, when I was working in an office, you know, through the hospital, I never even had to deal with that. It was always the front office dealt with all the insurance. Mm-hmm. I was just working with the patient, no big deal. And so for me, identifying that kind of problem helped me gear myself to maybe a way that streamlined the money collection and scheduling. That was the other thing. Scheduling was difficult for me because I'm the mother of 3 kids. So I really wanted to focus there and try to streamline some of the business, that extra business stuff. If I could streamline it, then I didn't have to deal with that headache part, and I could focus in a little bit more of what really made me feel good, mm-hmm. which was that one-on-one interaction with the patient or client. And so I worked with my website designer, and like we talked about, the website being your business card, that I worked on a way that we could do that little questionnaire to ask those screening questions so we knew that the program was appropriate, but that then someone is able to do the scheduling and the payment so that when we meet up and we make our appointment, I don't have to ask somebody for the money. Because it's streamlined, right? It's already taken care of. They've already paid for it. I don't have to worry about asking them at the end of every visit to pay for X dollars. And so that's been really helpful for me to learn more about those things. Like I said, if it's something that doesn't, it's not that you don't want to do things that are challenging, but if it really becomes something that this really isn't fueling my passion, then there might be a way that you can work around it and design your business life to really fit who you are. And that's not everybody's problem. I'm just sharing what my particular problem was. And so I felt like I had a couple of these false starts, where I was struggling with that payment collection and the scheduling and closing the deal, but that this new framework has been quite a bit easier for me, that someone remotely can decide they want to do it, even if they're referred from another clinician. It's clear, it's concise, and then we can focus our time together on the things that are things that I think are important and that fit who I am also. And so, again, this was also another thing where keeping yourself in mind as you design your business, keeping your tribe at hand, right? And I think it was trying to remember who was it that recommended that we set this up on, the website. And I was like, oh, you can do that? Like, I didn't even know you could do that. So that's where the tribe came in handy to help me design the business this time around to be more sustainable for who I am. Because I really didn't want to waste all my time and energy doing that as I'm raising my kids. So keep yourself in mind.
Good advice. So winning. Oh yes, winning. We all want to win, don't we? I think we're often told that to be a winner, you never quit, and that was the way to success. So why don't you talk a little bit more about what you've had to learn, and if there's something about quitting that you want to share.
So if we come back to my story with the orthopedic surgery group, when they turned down my proposal, that was a big no that I received. And then I had to stop and think about, well, does that mean I don't have something to offer? Is this the time to stop doing what I'm doing and refocus or reframe or change something? And I just continued to not really do anything specifically for the moment. But I came across Seth Godin, who's a entrepreneur. He's worked with people like Disney, and I remember seeing him at a physical therapy conference, and much of what he was talking about at the time didn't necessarily make sense. But he wrote this book, and it's called The Dip, where as far as being a sole business owner, there's this part where you end up seeing a dip in your results as your effort to make your gains increases. And that he talks about this dip being absolutely not the place actually to quit. That you do want to continue the effort because the results will be seen. But you have to know when you're in a dip or not a dip, right? Where a dip is where you're getting ready to take off, or the dip or at a different time where it may mean that you need to stop. And you and I had some discussions about this, and I think it's important, this is an important point as a private business owner, that it's not that I'm promoting quitting per se, but what I learned was how to determine when it's time to quit, because that actually allows you to win at something else versus trying to spin your wheels continuing to do something. And as I'm coming into the allopathic healthcare community and potentially hitting some barriers, this was an important thing for me to evaluate. And so I was working physical therapy and trying to do my private coaching practice at the same time. And I was having a hard time feeling like I was being successful at either one. And when I came across this book, he talks about, and I kind of put this together with another entrepreneur, to ask yourself a few questions when you're at a breaking point where you're trying to decide, is this worth continuing or is it time to move to something else? And this really helped me decide to finally put my clinical practice of physical therapy to put it on hold for a while I focused on this new business strategy. And so the questions are, what does your gut say? So coming back to your intuition and listening to what your gut tells you. right? Because we so often try to push through that, or we can reason ourselves out of our gut response.
Mhm.
And then to check your gut response is you ask yourself a few questions, like, is it working? You're either moving forward, you're moving backward, or you're staying still. And the only time to keep doing something is if you're actually seeing forward progress. If you're staying still or you feel like you're going backwards, then it's time to consider quitting. Does this bring me joy? And if yes, then go ahead and continue. If not, then you really need to seriously think about moving on to something else. Can I grow from this experience? I'm always interested in things that help you learn and grow. And I think if there's something that gives you an opportunity to grow professionally or personally, then it's well worth the effort that you're putting into it. Am I panicking? Am I emotionally reacting to something? And if the answer is yes, then you need to take a minute and think about it. And if we look back to the orthopedic surgery event that I had, I mean, I had a emotional response to when they did that. Absolutely. And I had to when I looked through these questions, I had to say, I just need to take a pause, let myself settle down and really evaluate before I make some dramatic decisions. And so that was really helpful for me. And then who am I trying to influence? If a person is resisting, if you're trying to change someone's mind, that has its limitations. And sometimes it might be impossible. And so could I have forced myself more on to, say the president of that orthopedic surgery group to see if I could change his mind? Well, the chances of that happening are slim to none. And so these series of questions have really helped me. So I used it not only in how I approached my response to how that orthopedic surgery group responded to my program, and I really felt like, no, my gut tells me this program is good. And if I asked myself a series of these questions, it gave me the time to take a pause, and then now I have this other opportunity where my program will still have the potential of helping many patients. And as I looked back on my physical therapy clinical practice that I was trying to continue while I was doing my education and trying to do this consulting business, when I knew in my gut that it was time to give it up. I mean, I really knew. I was like, I know I need to give this up because I'm just doing too many different things. And I checked my gut. And to be quite honest, at that time, it wasn't bringing me joy because I felt overburdened and overstretched. And I was always feeling rather, for lack of a better term, just exhausted when I was done with my clinical day. And so this has been this series of questions and this idea of the dip has been really important for me as a business owner, that I needed to decide to stop something. I mean, maybe quit's not quite the right word, but to stop something in order to win at something else. And I think that's a really important thing for that private individual business owner, to be able to have a series of questions or framework to be able to know, when is it worth the extra effort because you're in something called the dip where it's going to pay off, and when are you in a place where it's not the dip but that it's a time to make a different decision. And so I look at this as a positive, because if I hadn't been able to determine, one, that I needed to shut down my traditional physical therapy clinical practice, I wouldn't have been able to focus in on my program and see some of the things come to life that I'm seeing now. And if I had let the orthopedic surgery practice, they're saying no to me as a sign that I needed to quit, and didn't sort of clarify with some of these questions, then I would have lost out on something that I still think at this point is winning and progressing. And so as a private business owner, this one was just really, really helpful for me. And I think most private practice business owner can relate to that. So.
No, I think it's very important. And one of the things you've talked about here was the pause, the dip, and allowing yourself to pause so that you can respond appropriately versus just reacting, knee jerk.
Yep.
And versus quit is like quitting or stopping something. Pausing allows us to reevaluate and say, well, maybe this approach didn't work, but I can redirect myself to this. So it's not always a quit, it's a redesign, it's a redirect,
And you can even see how this would work with particular clients that you're working with.
Sure.
Right? That you're struggling with a specific client who either is not responding in the ways that you think, and this is kind of a checkpoint, where you can look at, well, is it just not working because I'm looking at this measure over here? But that, yeah, they, I had a client who I was frustrated with. We had worked with together for 3 months, and I was trying to get her to shift over to eating real foods, and she was raising children, and we got her even a professional chef because she didn't like to cook. I mean, we did all of this stuff, and what she walked away from our time together was that she gave up her soy lattes from Starbucks and, her vanilla, with all the sugar in it and stuff. And I was like, and I felt like I was defeated, right? That I didn't win at what I worked with her on. But then in the end, when I looked at these questions and we looked at different objectives, the fact is she lost weight, she improved her health. And so it did work, so this is a very useful, it's been very useful for me. And that's why I wanted to share it. Not that you aren't going to be successful, but that there will be challenges on the road and some are worth pushing through.
Great. Thank you for sharing it, for sure.
And that is it. Thank you very much.
All right. Well, it's been I really appreciate you coming here today and sharing your experience, your process, where you are now, and we just wish you all the success as you move forward. And I hope that you'll visit us again and to continue to share your good works and certainly your successes.
Absolutely. I'll keep you posted on my presentation to the hospital tomorrow.
I want to know all about it as soon as you walk out the door, for sure.
All right. Well, thank you very much.
Thank you again. And I just want to let you know that we're going to come back again for our next All About Alumni. We'll meet here on Wednesday, December 6th at noon Pacific time, and we have Kira Whitman with us as a graduate from our master's program. So until then, I wish you the best of health and take good care. And also check out Hawthorn's Facebook page right now. We just posted an announcement about one of our graduates, Ben Warren from New Zealand, who has a leading independent dietary supplement program, and he's been certified with all of his products, has been certified as being drug-free. And so, full evaluation of everything that was in it. Anyway, details on that on the website. Take a look. And thank you again, Carolyn. It's been fabulous having you with us, and we'll come back again. Everybody, take good care. Yeah, take good care of yourselves and each other.
All right.
Bye-bye.